Hello and welcome to Docplexus News. Let's discuss this week's healthcare headlines that matter. Providing relief to MBBS students, the Maharashtra government has pushed the mandatory rural bond service to academic year 2019-20. This decision comes after medical students strongly objected to government's decision making rural bond service compulsory for NEET 2018. As per this decision, students who cleared MBBS this year will be eligible for NEET 2018 even if they haven't completed the compulsory one-year rural service. The IMA Haryana is anxious that government will pass the Haryana Clinical Establishment Act without their agreed amendments. In this regard, IMA has threatened to shut all private hospitals if the act is drafted without the agreed amendments. The Uttarakhand government has offered up to double salary for retired army doctors to improve healthcare services in remote hilly areas. According to this proposal, salary will be based on the expertise and experience of the retired army doctors. The MCA has directed all allopathic medical practitioners to issue generic prescriptions only. The council has also warned that disciplinary action will be taken against doctors who are not prescribing generic drugs. This move is intended to ensure rational prescription and use of drugs. Many patients experience minor residual refractive error after cataract surgery, which requires the use of glasses. FDA has approved first device that makes small adjustments in the power of implanted lens post-cataract surgery and enables improved vision. This device is intended for patients who have astigmatism before surgery and do not have macular diseases. 51 essential medicines have been brought under price control by the National Drug Pricing Authority. Prices of drugs, particularly for treatment of cancers, heart and skin disorders, have been slashed by 6 to 53%. The ICMR chief Dr. Soumya Swaminathan has said that management of hypertension is very necessary for prevention and management of NCDs. In this regard, the Union Health Ministry is going to launch the India Hypertension Management Initiative to tackle the hypertension-associated disorders. This initiative will be launched in 25 districts to improve active screening and to intensify the hypertension treatment. Union Health Ministry has recently drafted the National Patient Safety Implementation Framework to ensure patient safety. The draft suggests incorporating selected patient safety indicators within the accreditation system for hospitals and laboratories. It also specifies that failure to deliver safe medical care will be attributed to unsafe clinical practice and poor system. Health Ministry has warned all hospitals that strict action will be taken for malpractices like overcharging patients and deviating from standard treatment protocols. The ministry has also asked for transparent and time-bound investigation for negligence and misconduct complaints against doctors. The move comes in the wake of a recent case of alleged overcharging of a dengue patient by a private hospital. Recently, the American Heart Association has revised hypertension guidelines defining hypertension for blood pressure of 130 by 80 mmHg or higher. In the view of these revisions, we have with us Dr. Chandler, who will give us expert opinion regarding how these revised guidelines are going to affect the hypertension diagnosis and management in the Indian context.
Hello, this is Dr. Anita Chandler. I am a cardiologist practicing in Pune. It is good that all the bodies got together and released a very comprehensive set of guidelines very recently. I am particularly happy from the viewpoint of interventions and preventing heart disease that the bar has been set realistically low. 130 by 80 is required in people with some target organ disease or comorbid disease which increases the risk of cardiovascular events like hypertension, coronary heart disease or kidney disease. In other people who do have a very high risk of events, this is a reasonable target. and that is what we should be aiming for. However, important variations and exceptions will remain. People need to tolerate the drugs to achieve and maintain these targets. Then this is, I believe, the one single important rider. Overall, I would say excellent guidelines, lot of clarity, very comprehensive guidelines, and they will definitely help all clinicians around the world.
Thank you, Dr. Chandler, for sharing your valuable insights on this matter. These were the latest happenings in the medical field brought to you by Docplexus, India's largest online community of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!